Hello, we're UPMC oral pathology residents. My name is Mobolaji Moore. I'm a PGY1.
And my name is Josh Goldfaden. I'm a PGY2. And in this video, we'll be talking about the week in the life of an oral pathology resident at UPMC. So we mainly work out of the dental school, and we have three different roles within the dental school. Those include being on biopsy service, being on clinical or seeing patients, as well as other. And then when we're not at the dental school, we are out on various rotations, which we will talk about. So delving into our responsibilities at the dental school, when you are the resident on service for the week, you are responsible for running the biopsy service. You preview all of the cases, prepare the reports, and come up with differential diagnoses for each case, and as well as any sort of recommendations for further workup, such as levels, stains, or molecular testing. So how the workflow goes, at the moment, dermatopathology processes all of our specimens. They are responsible for accessioning the cases, grossing the cases, and then creating the slides for us. And these slides are delivered to the dental school every morning around 10 a.m. or so. And most of the specimens are sent directly to dermatopathology. However, we do receive some specimens that come through the mail and they come to the dental school via UPS. And UPS typically arrives for around 9:30 to 10 a.m. every morning. So when you're on service, you're also responsible for checking the mailroom during that time to see if any specimens were sent to us, and we prepare them to be delivered to dermatopathology. And when our slides for the day are dropped off around 10 a.m., the delivery system will pick up the specimens that need to be processed, and they will be sent to dermatopathology. So once the resident on service previews the cases and comes up with differential diagnoses or further recommendations for workup, they gather the attending as well as the other residents to sign out together. And during sign out, we come up with the definitive diagnosis or determine what further testing is needed. With respect to the clinical role, we must be available to see patients. Typically, we see patients in the emergency clinic. That's where our pathology consults are scheduled. It's just across the hall from the resident room. And our consult times every day are 11 a.m. to 12 p.m. or 3 to 4 p.m. And there are a few exceptions to these timeframes, those being the pediatric clinic, the special needs clinic, or a consult needed in the faculty practice. These patients must be seen right away. And typically for consults in the faculty practice, one of our attendings will handle that consult. And also on clinical, we have the opportunity to and are encouraged to shadow our attendings in the faculty practice. For instance, Dr. Summersgill, our program director, sees patients every week on Wednesdays from 8 a.m. to 12 p.m. We get to observe him conducting an interview as well as a clinical exam. And many times we're also able to interview the patient under supervision so we can lead the appointment, perform the exam, and we also have an opportunity to do some biopsies and even cytologic smears. And we also have an oral medicine faculty here. Her name is Dr. Shekar. She sees patients every Monday morning from 8 a.m. to 12 p.m. in Montefiore, which is just across the street from the dental school. So it's a great learning opportunity to that as well. And then Mo, if you want to talk about the other responsibilities.
Of course, so when you're not on clinics and you're not on biopsy service, you do have a lot of time for self-directed learning. We have a huge bank of slides for you to learn from. We have multiple textbooks in which to use. We also have opportunity for you to have time to write grants, to do research, both within the faculty and outside the faculty as well.
Right. And when you don't have any pressing responsibilities when you're on biopsy service or on clinical, if you've completed your cases for the day or the consults for the day and you have downtime, of course, you can also study or work on research. So we do have a lot of flexibility in our schedule. So with respect to our weekly schedule outside of the biopsy service and clinical consults, we operate from 8 a.m. to 4 p.m. and we'll kind of take you through what we do every week. So on Mondays from 8:30 a.m. to 9:30 a.m., we have clinical pathologic correlation or CPC. This is an exercise that Dr. Summersgill leads. He'll show us different cases with clinical images, radiographs, and sometimes histologic images, and each resident gets to work up a case and come up with a differential. And this is a really good study technique for preparing for the CPC portion of the fellowship exam and the boards, as well as just practicing pathology. And on Monday evenings from 5 p.m. to 6 p.m., we do have the head and neck tumor board that is conducted by the ENT surgeons at Presbyterian, and they present different cases that they have during the week, and they typically review CT scans and PET scans. So that's another good learning opportunity, especially with respect to head and neck pathology as well as different imaging modalities. On Tuesday mornings from 8 a.m. to 9 a.m., we have AP Didactics. This is organized by the APCP residents at UPMC. These are Microsoft Teams meetings, and each week they have a different topic. So one of the attendings from a different area of pathology will present on a particular topic, such as thyroid neoplasms or pancreatic neoplasms, or even autopsy. So it's a breadth of pathology, and it's a great learning experience to broaden your scope of knowledge. And also on Tuesdays from 4 p.m. to 5 p.m., we have a slide case conference across the street at Presbyterian that's hosted by our ENT pathology colleagues. During this time, they share interesting and challenging cases and to come to a consensus, and that's another great learning opportunity. On Wednesday mornings from 8 a.m. to 9 a.m., we get to attend the Grand Rounds pain and headache lectures conducted by Mass General. These are on Zoom, and these are free CE credits, and it's a great learning opportunity to learn more about oral-facial pain and headaches. On Thursday mornings from 8:30 a.m. to 9:30 a.m., we have histopathologic unknowns that's led by our program director, Dr. Summersgill. During this time, we go over exchange sets from other institutions. Typically, the oral pathology residencies will exchange interesting cases that they've had, and the receiving program is to come up with the answers or a differential for the cases, and us residents work on it independently, and then we go over it together during this 1-hour session on Thursday mornings. Alternatively, we also look at some interesting cases that we've had in the past that we have educational recuts on. And on Fridays from 1 p.m. to 2 p.m., we try to do a journal club once or twice a month. So each resident will trade off and pick 1 or 2 articles to review, something that's interesting or something that's relevant to one of the cases that we had. And alternatively, we also will go over headache or pain lectures as well to broaden our scope in that area. So with respect to the rotations that we go on in our residency, we have rotations through ENT, dermatopathology, hematopathology. We have a week of autopsy, and we also have rotations through pediatric pathology, which is more systemic pathology focused, as well as bone and soft tissue and molecular, which is in the 3rd year. And the hours of the rotation vary. It depends on the attending who is on service that week or the attending who is in charge of the rotation. And it also depends on their workflow as well. And we are provided with a list of the rotations in a spreadsheet, and we have the contact information of the attending who is coordinating that, and you're more than welcome to reach out to them for further information as your rotation approaches to determine the hours as well as the responsibilities. And typically, more senior residents are expected to take on more responsibilities. So with that, we hope that you found this video helpful, and we thank you for watching.